Over the last month and a half or so, I've been using the ketogenic diet or medical keto as a treatment method for my schizoaffective disorder. We've also been implementing other metabolic therapies to see how this affects the management of my illness. I've been bringing you along with me on this journey, and I've noticed a lot of comments asking me how my symptoms are or how my mental health is doing. And I realized that I haven't really been talking about this much in the videos that I've been creating. And reflecting on this, I think this is largely due to the fact that I'm just not experiencing nearly as many symptoms in my day-to-day as I was before implementing the keto diet. And so that in and of itself is kind of worth talking about and what I want to talk more about in this video, as well as just kind of giving more information as to where my mental health is right now, how I'm doing, what I'm experiencing symptom-wise, and all of that kind of stuff. So when I stop and think about what my experience of my symptoms of my schizoaffective disorder are, and I'm talking about things that I typically used to experience, like positive symptoms, including hallucinations or delusional thinking or paranoia, or even the negative symptoms like decreased mood, decreased energy, those sorts of things, anhedonia, I realized that my experience of these symptoms has drastically shifted and changed. And I really don't find myself experiencing really hardly any of the positive symptoms anymore. And talking about hallucinations and delusional thinking and those sorts of things. Or if I do, I'm very quick to realize it and I can kind of correct or understand it's happening and move on. And this feels kind of really big because it's a very different experience of the symptoms that I have that go along with my schizoaffective disorder from what I was experiencing even just a month and a half ago. I really haven't experienced hallucinations very much at all in the last month or so. The really only marked time that I can recall is on a long run. I experienced auditory hallucinations, just voices. It wasn't anything terribly distressing or anything, but it was kind of weird because I realized that I hadn't been experiencing that regularly like I used to. And when I stop and think about this different experience of my symptoms, it's really hard to wrap my head around because I have also gone down on my antipsychotic medication to the lowest it's, I think, ever been. I was only down at this level one other time when I was trying to reduce, and I pretty immediately fell into psychosis and it did not go well. And so it feels really big and it feels really difficult to wrap my head around the fact that this could be happening and that my experience of my illness could be changing so much. And, I'm still not at a point where I'm willing to say, yes, this diet change and this lifestyle change has eradicated my illness, because I'm not there yet. But it is really encouraging the ways that my experience of my symptoms have changed over the last month and a half. Now, I'm saying all this, but today is actually probably the first day where I haven't felt that great. And it's not even that I'm experiencing any positive symptoms, because I'm not today. I'm just feeling a little bit off and maybe more of the negative symptoms creeping back up, or that anxiety that I had shared about a few months ago. But again, this is a bad day that I'm having right now, but I was still able to get going. I went out for a run. I got showered. I'm filming this video. And so perhaps understanding that the degree to which bad days happen has also changed. And this shift in capacity, even on a bad day, is something that I've been really, really noticing over the last month or so, where I just feel almost like a different person, whereby I have increased capacity, I have increased energy, I have increased creativity, and all of these feelings that felt, or aspects of me that felt blunted or stifled before, whether it was because of my experience of my illness and my symptoms or because of antipsychotic medication or psychiatric medication that was blunting me. I don't know, but it feels different, and it feels confusing on some level because I worry that, this increased energy and capacity and creativity and whatnot is the emergence of mania, because that's kind of what these types of feelings have always meant in the past. But I think what it is more so is me just becoming the person I am without the illness and without psychiatric medication. I was talking about this with Rob the other day, and we kind of coined the term of reemergence. And that's kind of how this is feeling, where I am reemerging from a place where I maybe was stuck behind a wall or some sort of barricade that was keeping me from fully experiencing life and things in the way that I can. And so that's something I'm kind of in the midst of exploring and trying to wrap my head around and trying to understand in the context of my experience of life. Now, that said, mania is something that is on my mind and something that I'm trying to be really cognizant of and aware of, not slipping into because of the things like I mentioned, like this increased capacity and energy and creativity and whatnot being perhaps a part of mania. I don't really think it is, but other kind of warning signs that have been going on have been having more trouble with sleep. And I am kind of in this phase of just being curious about what that change is all about. It's not even that I'm not getting enough sleep. I'm still getting at least 7 hours, more often 8 hours of sleep a night. And so it's not like I'm running on 4 hours of sleep at night or anything like true mania would be. But my experience of sleep has kind of shifted a little bit since starting keto, where I don't feel as sleepy. I don't feel as tired as I did before. And perhaps that is just an effect of my brain healing and me being on less sedating medication. I'm not sure. But other things like feeling, I lay in bed sometimes and I just am stuck in this thought of, this is a waste of time. I should just get up and do something productive instead, or go do something I enjoy and ride it out till the morning. But I don't do that. And I do try to still get to sleep and get enough sleep and whatnot. And so, yeah, I think just being curious right now about what is kind of, for lack of a better way to put it, just becoming a normal person again, who is not, kind of held back by symptoms of schizoaffective disorder or by antipsychotic medication. It's very likely that those things were affecting my sleep before. I was needing a lot more sleep than the average person before just to get by and still feeling sedated and tired throughout the day. And so if that is shifting and changing more into, again, for lack of a better word, a more normal experience of sleep, then maybe that's a good thing. Now, I should probably clarify all this by saying that this all is my experience of what it's been like using the ketogenic diet and metabolic therapies as a treatment for my schizoaffective disorder. And this is what the experience thus far has been like for me and how it's affected my experience of symptoms and my mental illness. It could look different for other people. This process could take a longer period of time than the month and a half that it's taken for me. I saw results fairly quickly, but I didn't go through things like the keto flu that many, many people go through. And so also, my ketones were really high from the get-go. And so it could look different for different people in terms of how they respond to this intervention. I think, though, at this point in the journey, it's hard to deny that something is happening that is allowing me to increase my functionality, feel better, decrease my experience of symptoms, and reduce medication. And now that said, it really was not my plan to reduce medication. I did that because I started to experience much or very, very increased levels of sedation because of something called potentiation, which I talk about more in this video here. But moving forward, now that that sedation has been resolved for the most part, I have no plans to keep reducing medication at that rate that quickly. I'm planning to stay at this level of medication so that I can work on, being as stable as possible using these interventions. And then once I feel that I'm at a point, and once my psychiatrist and my care team feels that I'm at a point where it's safe to start reducing the medications gradually again, we will look at that in a few months' time or whenever that may happen. So in terms of next steps with this project, we are obviously going to continue using the ketogenic diet, medical keto, but we've been talking more about metabolic therapies or other metabolic therapies as well. And we have been implementing aspects of these metabolic therapies, but we're really going to start trying to focus and really dial in things like sleep and exercise. So stay tuned for more information on those metabolic therapies. Thanks as always for all of your support throughout this project and for all your comments. It's really great getting to read them and seeing your own experiences using metabolic therapies or, being curious about things like these for yourself or for a loved one. So thank you again for all of your support and for following along. And as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.